Hey guys, Phil here, Doctor of Physical Therapy. Today we will be talking about shoulder pain with playing pickleball. Shoulder pain is probably one of the more common injuries that you can get from playing pickleball. So in this video, we're going to go over the reasons why your shoulder is hurting and what to do about it. So stick around to find out. A lot of times when you try to get help, say for your shoulder pain, you go to the doctor, they'll just say, hey, it's just wear and tear, you're getting old, and that's it. They'll tell you maybe to stop completely, to stop aggravating it. While there is some truth in that, yes, we don't want to keep aggravating the symptoms, but that doesn't mean stop completely. But the frustrating part of it is they don't tell you what to do about it. Here's where physical therapy comes in. Yes, as we age, there will be some physiological changes to your shoulders. We all age and we all are going to get something going on inside our shoulders. But pain is not inevitable, and sometimes doing some strengthening and doing the right mobility work can really help reduce that pain and keep you on the courts. Pain is just like a signal. It's our body telling us that there needs to be some kind of change. Okay, now we are going to get into why it hurts. So here are 3 reasons why your shoulder may be hurting. Number 1, rotator cuff changes. Your rotator cuff is a group of 4 smaller muscles inside your shoulders that is in charge of just stabilizing it and just keeping it in a good position. Here's a little surprising fact that you may not know. If you're over 40, more than half the population have some kind of rotator cuff tear inside their shoulder. MRs are so great at finding the tiniest details inside your tendons now that, hey, if they look hard enough, they're going to find some changes. But a lot of these people don't know that they have a tear and they live life without shoulder pain. So this gives us hope, because this tells us that, hey, your shoulder, maybe there is some structural changes inside your shoulder, but it doesn't have to hurt. Because the truth is, sometimes pain comes from the inflammation around that area, and it doesn't actually come from the tear itself. The good news is, if we specifically target these tendons, we can get them stronger. Even though they may be partially torn, we can get them stronger, and which will help decrease your pain and improve your function. Number 2, you may be having pain because of a lack of thoracic mobility. So what that means is thoracic spine is just this area between your shoulders and your kind of lower back, so your rib cage area. And when you think about it, your shoulder is connected to this rib cage, right? So if you have limited mobility here, say you raise your arm and try to go for an overhead smash, you can't really go because of a decrease in mobility here. Number 3, weakness inside some of these posterior muscles. So in general, us humans, we're always forward. Say we're always sitting, we're always driving, everything is hunched forward. So naturally, that can contribute to number 2. So you're more flexed, leading to a lack of mobility in your thoracic spine, so your rib cage area. As a result, your posterior and your back muscles are just a little bit more stretched out and weaker compared to the front, just by prolonged positioning. So these are the 3 factors that can contribute to you developing shoulder pain. But here is what we're going to do about it. So to get to the root cause and to directly target those smaller rotator cuff muscles, all you need is an exercise band. I have mine right here. You're going to stick your chest out, shoulders back and down, elbows by your sides, and all you're going to do is pull out to the side. And it's really important to keep your elbows in and close by your sides throughout this motion. And this might not look like much, but as you do this, you should feel a small burn in the back of both shoulders, and that is your little rotator cuff muscle working. So doing this every other day, 3 sets of 10 to 15, will really go a long way. And you want to keep it nice and slow as well. Number 2, another one is to work on your thoracic mobility. You can easily do this with a chair that has a lower back. So basically, you want to support your head and gently lean back into the back of the chair. Just like that. Just go as far as you feel comfortable going, and you can kind of find whatever angle feels the most good to you. Sometimes you'll find like a stiffer spot that you can hang out more at. Yeah, that's something that you can easily incorporate into your day. Number 3 is to work on your posterior muscles more. So the back muscles, the pulling muscles, You can do band pull aparts. You can attach this to something sturdy and then perform some rowing as well. Doing all these things will supplement your pickleball playing, build a stronger shoulder, and keep you healthier. These are all great first steps. Of course, everybody's different, and sometimes some things can take longer, especially if you have a really reactive rotator cuff tear and it's confirmed and it's just ongoing. We want to listen to the body and not keep aggravating it. All of these exercises shouldn't piss off your shoulder that much. Say it's not getting any better, it's starting to affect your day-to-day life, I do recommend seeing a physical therapist to get a formal assessment. That way you'll have a specific plan to get you back to playing. So give these things a shot. If you're looking for some more guidance, I also do offer virtual consultations. If you're interested, you can look in the link in the description below. Stay healthy and take care.